started in 2002, was the first year that we participated as a district in the World Breastfeeding Week activities, and we held the Breastfeeding Challenge that year. And then in 2000, and we held it annually from there. And then in 2011 was when we added the walk-run component, which added a fun component to it, and also increased the involvement with the community as a whole.
It's a good opportunity for families to come together and have some fun involved in some physical activity. There's the 5K run.
The week where we're trying to promote awareness, bring awareness to breastfeeding, promote it, advocate for it, and just talk about any opportunity we get to talk about the importance of breastfeeding. It happens early in October, and we have a run and a Quintessance challenge. So that's breastfeeding week to me.
We need to have people be more aware of the importance of breastfeeding, both mothers, families, communities. So I think they're really important in that way. I also think they're part of an ongoing education efforts, because it's more than just 1 week or 1 day of events that are needed. So it's one part of the ongoing work that's happening around breastfeeding in public health as well as in other areas to increase our rates of breastfeeding and to have people be more knowledgeable around the importance of breastfeeding.
Things like the Breastfeeding Awareness Week is really great because it brings a whole lot of people together. You get the support from other women who breastfeed, and you get the support from businesses who come together and choose to support Breastfeeding Awareness Week.
It allows the community and the moms to be comfortable and normalize the act of breastfeeding.
And I think when these moms get together and they chat with other moms that have kids, children the same age, babies the same age, that they realize that they're not the only one that's going through if they're encountering some challenges and that. So it gives them some peer support as well to get together with other moms.
And more so the families. It's the mothers, but it's the fathers now as well too. And it's just letting them know the importance.
I would just tell them to come on out and meet other moms that are doing this. That's the biggest thing, to get their support from their peers. And I think that's really important for moms to continue breastfeeding, is peer support.
I know that it's good for my baby, I know that it's good for me, and I really enjoy doing it. It was just a time where you're close to your baby.
I knew it was just a great way to go because of the convenience of it, the low cost, the ease, not having to make bottles all the time, and I knew it was going to be difficult at first, but I had a lot of support.
That in Cape Breton, we have a very high rate of chronic disease. So breastfeeding is kind of the start of preventing that, and it helps prevent diabetes and some forms of cancer and other long-term diseases like osteoporosis and that sort of thing.
We developed an amazing bond. We save money. There's really no negatives from breastfeeding. It's all positives.
There's also benefits for the mom for breastfeeding. It helps reduce her risk of breast, endometrial, and ovarian cancer. Also reduces her risk of osteoporosis, rheumatoid arthritis, and also postpartum depression.
It saves you money. It's great for the baby's immune system. It's very convenient. It has everything that you need in a very quick fix, and just it's the gold standard.
It gives you something to look forward to, and you kind of hoped, like how I did when the breastfeeding run was going on in October, and I had delivered her in January, so it was kind of my goal to make it to the Quintessance Challenge and the breastfeeding run and still be able to successfully nurse, so I can say that I went and did that.
I think it's a way to celebrate their accomplishments and a time to be proud of it.
I think it's been a lot of fun. All the times that we've been there and the moms that participated, they've all talked about how much fun it was. And the run really added a nice component to it, because we got people there that weren't breastfeeding moms, and so we got another part of the community involved as well.
If you want to be able to meet other families and other mothers that have done the same thing, It's a networking piece. It allows you to get out actually and be healthy in the sense of the run. And for that, as far as the Quintessance Challenge goes, it gives you some insight as to what other mothers and what other families have done up to that point, and just to meet new people.